Continuing with the coverage of the President's address to the nation, we are now joined by political analyst Levy Ndou. Mr. Ndou, a very good evening to you. Thank you so much for joining us. What are your thoughts on the President's address earlier on? Is it what you expected?
Good evening, Simpiwe. Good evening to the viewers at home. Indeed, that is what I expected. But there is one particular area that I think the President emphasized on.
Yeah.
And he had to emphasize more on the importance of vaccination and how people that have been vaccinated are able to survive compared to those that are not vaccinated. And for me, the President has to spend a sufficient a period of time encouraging South Africans to vaccinate and ensure that indeed we save lives and preserve the most important thing, which is life. But another thing, Simpiwe, is that I actually expected the President to ease the regulations on the basis of the fact that indeed South Africans are in compliance and the numbers are actually going down. And this is one thing that would actually also be well accepted by different political parties as they prepare themselves for the local government elections.
Now, Mr. Ndou, the President also made mention of the contentious issue of vaccine passports. And I know that it's been argued that requiring proof of vaccination to re-enter society may violate, freedom of choice, and that a requirement to vaccinate to fully re-enter society may also kind of stigmatize those who opt not to vaccinate. Could this be an indication that a mandatory vaccination is on the cards?
It might be, Simpiwe, but I think government is trying its best. Firstly, to ensure that citizens are encouraged to vaccinate. And as you know, there are a lot of stories surrounding vaccinations. And I think it's trying its best to ensure that everybody else gets encouraged to vaccinate. But there is also another area that I think it's important that we need to touch on. That even before COVID-19 came into being, you would have people having to go through some sort of vaccinations if you have to visit other countries. For an example, yellow fevers, people will have to be vaccinated so that they actually do not get exposed to the diseases elsewhere. And of course, government, without any form of forcing citizens or encroaching on their rights, I think it is upon government to do all they could to encourage citizens to vaccinate as long as they are able to provide sufficient proof like the President did today that will actually encourage everybody to vaccinate and do what is best to all of us.
Now, Mr. Ndou, seeing that the government still hasn't taken a position on those companies and organizations which are now forcing its workers and employees to go for a mandatory vaccination, I suppose it'll be a very tough balancing act for the government, as it were. I mean, respecting, first of all, the rights of people to vaccinate or not to vaccinate on the one hand, and then achieving herd immunity and ensuring, COVID-19 free status for all and health for all here in South Africa. So how do you envisage that the government will deal with this particular narrative decisively?
In South Africa, Simpiwe, there is an emphasis on the right of citizens, which is also there in our own constitution. And the government has to train very, very carefully in whatever decision that they take so that they do not have to be seen to be violating the rights of other citizens. But I think what is important for me is that government has to try much harder and ensure that they encourage everybody else in order for everybody to be able to vaccinate and do the right thing. And I think at this stage, one would expect government to intensify information sharing, publicity on vaccination, so that government has to push people and end up encroaching on their rights. And I think at this stage, government it seems to be moving in the right direction, and all they need to do is to put more effort so that at the end of the day, we must have the majority of all citizens vaccinated. of encouraging a lot again is that vaccination is now open to everybody irrespective of nationality. So if there was a fear that you've got undocumented citizens or some nationals, some internationals who felt that they might be prevented from being vaccinated, it is now open to everybody. So indeed, government seems to be moving in the right direction in the program towards vaccination.
All right, Mr. Ndou, great chatting to you. Thank you so much for joining us.
Thank you, Simpiwe.
Political analyst Levy Ndou joining us live on the line and has been commenting on the president's address a little earlier. Well, health expert and former president of the Health Professions Council of South Africa, Dr. Kgosi Letlape, joins us now to share his views on the latest adjustments. He is on Zoom. Dr. Letlape, very good evening to you. Thank you so much for joining us. Welcome to the Globe. First of all, your thoughts on the president's address earlier?
Good evening to you and the viewers. I guess we had anticipated that there would be relaxation of the restrictions. But there are a few things that are fairly surprising in terms of some inconsistencies. If we increase indoors from 50 to 250, but we still keep funerals at 50, some people might be asking what's the difference. Even though I welcome that, I hope people will learn the fact that the virus does not take a holiday.
Yes.
So anywhere where people are gathered, the chance for transmission becomes quite high.
Yeah.
So I'm happy that the funerals have been kept at 50, but people should exercise their own wisdom and judgment to be in gatherings of 250 people or more, 250 people in a confined space.
Yeah.
I would be cautious of going to gatherings like that. And I guess there's pressure in terms of the local government elections that are coming up. And maybe it is time we ask our politicians to be innovative and to use technology better so that we still reduce the number of people at gatherings, because that is the main way the virus spreads. But all the other measures are most welcome. I'm also pleased that the president has been consistent about not mandating vaccines and encouraging people to vaccinate. And I think people should not confuse the issue of, if you're not wearing a mask right now, you're not allowed into facilities. So there should be nothing wrong with, if you're not vaccinated, not being able to access certain things. Just like if you're not wearing a mask, you're not allowed. And nobody talks about your rights being violated. It's about a precautionary measure to cap the spread of infections. So vaccines will not be mandated, but there should be consequences for not being vaccinated. And there should be benefits for being vaccinated. Just like if you're wearing a mask, you're allowed to go into shopping areas. If you're not wearing a mask, nobody talks about your rights. They stop you. They say it's a condition because we are in the middle of a pandemic. So those are the issues that I think people should remember. Lastly, we still need to ensure that we increase our efforts in reaching the over 60s. If you listen to where the president started, if you look at the figures from the Western Cape, the majority of people that die are still our senior citizens. Now, we need to look at more creative ways of how we're going to reach them.
Yes.
Most of the people above 60 are pensioners. You can't say you're going to fire them from work because they're not working. So what are the things that we can do? There's low-lying fruit. The medical profession has not been fully engaged in terms of this pandemic. We have many general practitioners out there who have their own infrastructures, who've been given injections to patients all their careers and all their lives, who have their own facilities that could be used as vaccine sites. If you recruited 5,000 GPs and they did 10 vaccines per day, that's 50,000 per day. If you recruit all GPs, you can get on close to 100,000 extra vaccines per day without raising a sweat. But here's the other major advantage. The people that are over 60, a lot of them have their own GPs that they go to. GPs are where the people live, particularly the GPs that serve the marginalized communities. Their practices are in the townships. Their practices are close to the villages. So if you recruited GPs, you'd be able to have people that patients trust, that could explain to them the truth about vaccinations and the benefits of vaccinating in this pandemic. And then also being able to receive that injection from a practitioner that you trust, who will be able to deal with any side effects that might arise. If you have any symptoms, it will be better than phoning a call center when you call a GP that has given you your injection. So there is low-hanging fruit where we should engage. We've engaged community pharmacists. We've engaged commercial operations. There's a far, far more effective resource that we can use that is trusted by the people of South Africa and by the patients, our family practitioners. And even nurse practitioners that have independent practices.
It's quite interesting that you've made the point on GPs and most GPs which are, resident in the communities and the villages. And I'm actually reminded of this particular GP that was in Mpumalanga who's been in the headlines for all the wrong reasons, saying that he will not attend to patients who are not vaccinated. So I guess then it takes us back to the issue of mandatory vaccinations. And you say that people will not be forced to vaccinate. But I suppose the jury is still out on this particular matter because the government has been silent on the companies that are now forcing its employees to vaccinate. And the president, the fact that he said that we will not achieve herd immunity if we don't vaccinate, isn't that a subtle statement that a mandatory vaccination is on the cards?
Well, I don't know, but as medical professionals, we do not force anyone to have any treatment that they do not want to have, even if that treatment is life-saving. If you are of sound mind, we have to respect the decisions that you make.
Okay.
That's the ethics of the profession. Now, let me just go back slightly. The issue of the GP from Mpumalanga, I've had him explain himself that there's been a certain level of misrepresentation. He was speaking to patients of his, and a group of particular patients living with HIV that he's been with for the last 20 years.
Yes.
And some of them were refusing to take vaccines. And he was saying to them, I know you personally. We know the benefits of vaccines. People amongst us have died from around that 100. I cannot lay idle when you people are endangering yourselves and by extension would endanger other people. So he said, I will not see you. But he has clearly stated that any person that gets on his doorstep, he will see, even amongst those. But he was informing them that for him, when you make a conscious decision not to vaccinate, make a conscious decision to go elsewhere.
Right.
And he's trying to show the people the importance of vaccinating. But he was not saying he's going to deny people care.
And what you're saying, I suppose, it ties in well with the issue of, vaccine hesitancy here in South Africa. How do we deal with it for those who still want to vaccinate, but they still indulge themselves in the inaccuracies around vaccinations?
I think if you go back to GPs, those are the people that people trust. Those are the people that people go and see every day. Those are the people that people listen to.
Yes.
Now you have people that are not patient-facing, and they are the ones communicating. Remember, we respect scientists. What we do as clinicians is based on scientific endeavor and scientific facts. But we are the ones that are patient-facing. We know how to communicate with our patients. So take the communication to people that have been communicating with patients for as long as they have been practicing, and we will be able to make the issue of anti-vaxxers an issue of the past. We also need to understand that language is important. I mean, as a surgeon, as a doctor, I've seen people that are blind, and I could offer them a procedure that I know is relatively safe and would restore their vision. But I would never force anyone that became concerned about the minuscule chance of reacting to a local anesthetic or a general anesthetic.
All right.
And I would still want to inform them so that they make an informed decision. But I wouldn't force anything on them. So recruit the medical profession, and we will deal with those issues. And when you make an informed decision, I will not call you anti-progress or anti-this. I will see you as someone that is electing not to be vaccinated. And I would still have a duty to try and reach you. Let us not create an apartheid system where it's us against them.
Indeed.
Let's work on this thing together and say people have concerns, and when people have concerns, our ethics as medical doctors is to engage them and address their concerns and try and show them the light.
Point taken, Dr. Letlape.
Holding their hands,
and thank you so
much.
much.
Not label them.
Indeed. Thank you so much for your reflections and for your thoughts on this matter, Dr. Letlape. We do appreciate your time.
Thank you very much. And people, please vaccinate, because that is not only going to help society, it's going to help you at a personal level, so that if you contract COVID, you will not get a severe disease. I vaccinated in March. I contracted COVID in July. I am here. I was able to be treated by my doctors at home, and I survived.
Okay.
I wish the same for you. Let's vaccinate.
All right, lovely chatting too, sir. Thank you. That was Dr. Kgosi Letlape. Well, he's a health expert and former president of the Health Professions Council of South Africa. Let's now